Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Fariha Saleem, and today we are going to start with varicose veins. So, you have studied about DVT, that is deep venous thrombosis. Okay, now we will start with the varicose veins. Varicose vein is the one that is dilated vein, and basically, when the vein gets dilated, the valves are not working properly, so it does not prevent the backflow of blood, which is mandatory. So, when such veins lose their elasticity, they become elongated, tortuous, and their fibrous tissue is being replaced by tunica media. So, the basic anatomy of the veins are deranged. The physiology is also deranged because now the veins are more dilated and their valves are not working properly. Okay, so what are the predisposing factors? Predisposing factors are those factors which may lead to such condition earlier than possible. So the first predisposing factor is hereditary, that it can be passed through genetics. The next one is that females are more prone to get varicose veins as compared to males. Also, one of the most important predisposing factor is pregnancy. Another is age, that is old age increases the chance of getting varicose veins. Okay, so if a person is obese or is in long sitting or standing position, then also the chances of getting these varicose veins increases. Also, the factor of pressure is also there. Okay, so varicose veins of the legs. Let's study about this. When valves in the anastomosing veins become deep and superficial leg veins become incompetent, so the venous pressure in the superficial veins rises. Okay, in the long term, when these veins they stretch and become chronically dilated because the superficial veins are less well supported by surrounding tissue than the deeper ones. Such areas show the skin as varicose veins. So basically, the veins, superficial veins of our arms and legs, they are obviously less supported with skin as compared to the deeper veins. So when the superficial veins get dilated, they can be easily shown or easily seen from the skin. So these are called as varicose veins. Okay, so the most important varicose veins are saphenous veins and the anterior tibial veins. Okay, and what happens is that they cause aching and fatigue of the legs, especially during long periods of standing. Okay, let me show you a diagram. Okay, so you can see these varicose veins, they are on the tibia region, and you can see that they are very visible on the skin. And on the right side you can see there is a normal vein with proper valves, and below it there are varicose veins, and you can see that the valves are not closing properly, so it does not prevent the backflow of blood. So what are hemorrhoids? Hemorrhoids, okay, so we have just studied about the varicose veins of the legs. Now these veins, these dilated veins, they can occur on different parts of our body. If they occur on the legs, they are called as varicose veins. If they occur on the junction of rectum and anus, it leads to hemorrhoids. Okay, so what happens is that if a person is suffering from chronic constipation, or there is increased pressure in the pelvis area at the end of pregnancy, it leads to distortion or dilated veins in the junction of rectum and anus region. Slight bleeding may occur when the stool is being passed, and it may lead to anemia. Okay, so let's see the diagram of hemorrhoids. You can see a slightly large internal hemorrhoid and an external hemorrhoid. So basically, what happens is when the stool passes through this area, through the anus, these veins they get damaged because they are already dilated. It has a very thin epithelium, very sensitive epithelium. So when the stool passes through the anus, it may cause bleeding from these internal or external hemorrhoids. And normally, if the constipation is treated and it gets better, then there is no need of surgical removal, it reverts back. But if the constipation problem is not corrected, then surgical removal of hemorrhoid might be necessary. Okay, then is the scrotal varicocele. So if these varicose veins are present in the testicle region, this leads to scrotal varicocele. Let's read from the paragraph. Each spermatic cord is surrounded by a plexus of veins that become varicosed, especially in men whose work involves standing for a longer period of time. So this basically occurs in men who are standing for a longer period of time. Okay, so if now the fourth location we are studying about, if these varicose veins they occur in the esophageal region, then it leads to esophageal varices and it might rupture, which leads to potentially fatal hemorrhage. Okay, so we have studied about four types of varicose veins. The first one was the varicose veins of the legs. The second one was hemorrhoids, which was at the junction of anus and rectum. The third one was scrotal varicocele, which were the varicose veins of the testicle region. And the fourth one was the esophageal varices, which was varicose veins of the esophagus. Okay, let's study about the tumors of blood and lymph vessels. Okay, now angiomas. What are angiomas? Always remember that when a word ends with oma, like angioma or hemangioma, that means that this oma means that it is a benign tumor. Okay, like sarcoma. But if it ends with sarcoma, like you can see that basal cell carcinoma, okay, that means that sarcoma words show that it is a malignant tumor, not a benign one. Always remember this. Okay, so angiomas are benign tumors of either blood vessels or lymph vessels. If there is a benign tumor of blood vessels, it is called as hemangioma, and if it is a benign tumor of lymph vessels, it is called as lymphangiomas. Okay, so the lymphangiomas are very rare. So normally, if we talk about angiomas, we take it as we are talking about hemangiomas. Okay. Okay, so hemangiomas, they are not true tumors, but they are similar, or you can say that they are sufficiently similar to be classified as such. Okay, so what happens is in hemangioma is that there is excessive growth of blood vessels, which are present in uncharacteristic manner, and they are interspersed with collagen fibers. Okay, so just keep in mind a picture of hemangioma, that there is excessive growth of blood vessels and it is interspersed with collagen fibers. Let's see a picture of hemangioma. Okay, this is a true picture of hemangioma. There is excessive blood vessels and it is filled with collagen fiber. Okay, so what are capillary hemangiomas? Excess capillary growth interspread with the collagen in a localized area. It makes a dense plexus-like network of tissue. It is same as that of hemangioma. The only difference is that there is excessive capillary growth, which is interspread with collagen fibers. Okay. Each hemangioma is supplied by only one blood vessel, and if it is thrombosed, then the hemangioma atrophies and disappears. If you can recall, thrombosis means presence of blood clot. So if a blood clot appears in the hemangioma, obviously the blood clot will reduce the blood supply later on, completely diminishing the blood supply, which would lead to atrophy and disappearance of that hemangioma. Capillary hemangiomas are usually present at birth and are seen as purple or red mole, or may be called as birthmark. You people might have heard about birthmark a lot of time. So that birthmark is basically that capillary hemangioma. They may be quite small at birth but grow at an alarming rate in the first few months. keeping pace with the growth of child. After first to 3 years, atrophy may begin, and atrophy means that it will lead to reduction in the size. And after 5 years, about 80% of the tumors have disappeared. Let me show you a picture of it. Okay, as you can see that initially the baby had a very small birthmark. Comparatively, it's not that small, but comparative as compared to the later on picture, it seems smaller. But with the passage of time, as the baby grows, this hemangioma also kept on increasing. But remember that after 5 years, this will reduce in size. Cavernous hemangiomas. Blood vessels larger than capillaries, they grow in excess of normal needs in the localized area and are interspread with collagen fibers. So these are cavernous hemangiomas, are those hemangiomas in which the capillaries are larger, the blood vessels are larger than capillaries. They are again dark red in color and may be present in skin, but they are most common in liver. Okay, edema. Okay, you must have heard about the word edema. This is basically accumulation of tissue fluid. It leads to swelling and it might be superficial or deep. Site of edema. So basically, when the edema occurs, it might be in the limbs, in the hands, in the ankle region. So there are different types of edema. The one we are talking about is pitting edema. The word pitting means that when we press on the skin, it makes a pit and the skin remains there after even a long period of time. That indentation remains there because there is tissue fluid, excess tissue fluid over there. Okay, the sites at which the edema is normally observed is influenced by or dictated by gravity and the position of the individual. If a person is standing for a longer period of time, then the edema might be seen in the lower limbs, beginning in the feet, or if the patient is on the bed rest, then edema might be seen in the sacral region. Sacral region is basically the area below the spine. Okay, so if the edema is dependent on the position of the patient, then this is called as dependent edema because it is dependent on the position of the patient. Okay, another type of edema is called as pulmonary edema. This occurs because of cardiac failure or inflammation of the lungs. Okay, so or in case of excessive infusion of IV fluids. Okay, so what happens in pulmonary edema is that basically there is excessive accumulation of fluid in the tissue spaces and in the alveoli. So obviously the alveoli cannot contract or relax properly, and it will not cause that efficient exchange of oxygen and carbon dioxide. Okay, so this leads to dyspnea, that is breathlessness because there is lack of oxygen in the body, cyanosis, that is blueness of the skin, and coughing up, expectoration of frothy sputum. That frothy sputum might comes out from the patient's mouth. So we have talked about pitting edema, in which there is indentation in the skin when firm pressure is applied. We have also talked about dependent edema, the edema which is dependent on the position of the patient, and we have talked about the pulmonary edema, which occurs because of cardiac failure or inflammation of the lungs. Now we will talk about causes of edema. Okay, so causes of edema might be increased hydrostatic pressure, as you can see in the picture. Okay, this A picture, this shows normal blood flow. There is capillary below, blood capillary or blood vessel. Above it is the tissue space. You can see that there is normal level of plasma proteins in the blood capillary or the blood vessel, and normal fluid content in the tissue space. Okay, but what happens if there is decreased plasma osmotic pressure? Okay, if there is reduced plasma proteins in the blood vessel region, this area, then what happens is you can see that the difference between A and B is that In A, there are more plasma proteins, which is denoted by P in the blood vessel region, and in B diagram, there are less plasma proteins. So, if you can recall your previous knowledge that proteins or the solutes, they attract solvent. If there is reduced amount of solute, it will attract less solvent. So what happens in case of decreased plasma proteins in the blood vessel is that reduced amount of water will come back into the blood vessel and more water will accumulate in the tissue space, leading to edema. Now let's come to the diagram C. Okay, you can see in this diagram in A and B that some of the water is escaping into the lymphatic region. This green part, green circular region on the right side is the lymphatic region. Some of the water is also being regulated by passing into the lymphatic region. But if there is deranged, or you can say that damaged lymphatic system because of any carcinoma or any or removal of the lymph nodes, then these water molecules would not pass into the lymphatic region, leading to again accumulation of fluid in the tissue space, leading to edema. Okay, there is another condition in which there is increased capillary permeability. Increased capillary permeability means that more of water molecule and proteins are passing through the capillaries as compared to normal. That is, the permeability of the capillaries is increased. In this D diagram, you can see that more of the plasma proteins have passed into the tissue space, and almost all of the water molecules are into the tissue space. That will lead to again again accumulation of tissue fluid, because normally the water should come back, some of the water should come back into the blood vessel region, but in this case it is not coming back, thus it will lead to tissue fluid accumulation. So we have talked about 4 scenarios. The first one, A part was normal. The B one was there was reduced plasma proteins in the blood vessel region. C was that there was damaged lymphatic system, and the delta one was that there was increased capillary permeability. All of these 3 causes will lead to accumulation of tissue fluid, thus leading to edema. Okay, so we have covered varicose veins today. We talked about hemangiomas, capillary hemangiomas, and varicose veins of the legs, and esophageal varices. And then we talked about edema and the sites of edema, the causes of edema. I hope that it is clear. Just go through it from your book, and then we will talk about ascites in the next lecture. Thank you so much.